Hello, everyone. Today we have
Hello.
today we have the lovely Beverly with us. Beverly, please go ahead and start us off. When did you get diagnosed with diabetes?
I was 25 years old, and after having 5 or 6 years of on and off low blood sugar, and it was 1985. I was 25 years old. I knew what it was. My grandfather had type 2 diabetes, and I knew, I was up in the middle of the night going to the bathroom a dozen times. I was exhausted. And so I went to the clinic at Balboa Hospital in San Diego and said, I think I have diabetes. And they, of course, laughed at me. But that was way back in the day. A lot has changed. I was actually quite fortunate because I did have a meter to test my glucose on. And even though it was only twice a day, I didn't have glass syringes and I didn't have beef or pork insulin. Humalog was just new on the market, as I recall. And so, I went in at first and they told me I think I'd lost like 13 pounds or 16 pounds in a month. Um, we had spent 2 years on Guam. My husband was in the military, so we were on Guam for 2 years. And when we got back, that was a really stressful time, and it's all up in the air about what causes it and how all this happens. But it was quite a stressful time for me. I had a 3-year-old and a 5-year-old. So when we got back to San Diego from Guam, we only had one vehicle. So my husband was in the military, so like I said, so he would go to work, and I would walk the mile just inside of the bus range for whether or not you walk or take a bus. And so I would walk with carrying my 3-year-old 1 mile to the school in the morning and 1 mile back home. And then after school, I would walk 1 mile to school to get him and 1 mile back home.
Wow.
So I was pretty active at the time. They actually put me on a medication called diabetes. I had a 350 fast, even with all of that exercise. I had a 350 fast, and they put me on diabetes. And women and yeast infections and high glucose was a big deal for me quite often. And so I developed a secondary infection, and I went to my GP, and he said, okay, first of all, you're not type 2, you're type 1, you need to be on insulin. So he sent me to a very good endocrinologist in the San Diego area. And that's when I became familiar with NPH and regular. And at the time, insulin pumps only had bent needles with no Teflon, no cannula, nothing like that. So after about a month, I ended up on an insulin pump. I started on a Medtronic pump. I think it was a 502 or something like that, but it was pretty cool. I was able to put a couple different profiles in, and I went off eating whatever I wanted because I could cover it with insulin. And, it was weird because they gave me that green sheet. It was only two-sided. There was no internet at the time. I mean, there was nothing. Our computers had floppy drives, and you had to upload DOS to get it. So there was really no, other than going to the library, there wasn't a whole lot of options. You did what the doctor said because it was the doctor. So he gave me this sheet of paper, the exchange diet. And I thought that I was a little bit heavy, which I probably wasn't. And so he gave me 1,200 calories.
Ooh.
1,200 calorie exchange diet. And on the front, it had, I know, I'm 5'10". I wear a size 12 shoe. Totally inappropriate. But on the front, it had how many exchanges I could have per day and with which meal. And on the back, it was the choices that I could have from each one of those exchanges. And so for breakfast, I recall I had a real issue with it because I don't drink milk. I don't like milk. And I was to drink a glass of milk in the morning with a piece of bread and one protein, which was always an egg because I didn't eat chicken for breakfast. So it was an egg, a piece of toast, orange juice or a banana, half a banana. I was doomed from the start. That's all there was to it. I was doomed from the start. We started playing with how much insulin should I take per gram, 50 grams of carbs, doing the math and trying to figure it out, trying to get the basal rates right. at that time you had to go in the hospital for a 24-hour stay so that they could try and adjust basal rates, except I wasn't fasting. So I don't know really at this point. Now I don't know how I was supposed to do that or how they were even going to do it. But I remember I was allowed 4 squares of graham crackers with 8 ounces of milk as a bedtime snack. So we put that on your stomach before you climb into bed. And I remember saying, I don't like milk. I'm not gonna drink milk. And he said, well, then you can exchange it for another carb exchange, which actually is twice the carbs as the milk. So, and off I went on my merry way, and I would go to the doctor, and he would say, your A1C is too high. Your A1C is too high. You need to take care of this. You're going to have complications when you get older. And I probably knew what the complications were to some degree, although diabetes doesn't hurt. It's not pain. So I think I probably didn't take it as seriously as I should have. I mean, I had my automatic delivery system on my hip, and if I wanted a grilled cheese sandwich, I would have a grilled cheese sandwich. But he wanted me to bring the numbers down. He wasn't telling me how, other than eat graham crackers and drink milk at night. He wasn't telling me how. But I know that, I don't remember the exact numbers of my A1C. I want to say 11 or 12. 11 and 12 sticks in my mind. But the funny part about the whole thing is I don't recall any lows. How high do you have to be if you don't have any lows? You know, and I've thought about that often, because if I were closer to normal and had a couple glasses of wine in the evening, I would bottom out in the middle of the night. I mean, I know that now, but I mean, I traveled around 300, 250, 300 for the most part. And he threatened to take the pump away from me. He said to me, you're driving this very expensive car without a driver's license. But the same diet plan, that same one piece of paper, you know, staring at me. And I never got it right. And we were at odds a lot because I couldn't get it right. Fact of the matter is that I am a crazy carb addict. My brain lights up. You could actually be addicted to carbohydrates and sugar. And I believe that 100% now because of my own experience. I would get up in the morning, I would follow the diet plan just exactly the way they told me. My 1 egg, my half a banana, or my cup of juice, and my 1 fat. And by 2 o'clock, I'd be ripping my hair out, looking for anything to eat that wasn't moving. And that was my sensitivity to carbohydrates. I've been fighting the same 40 pounds just about for my entire life. And it's because I couldn't keep my hands off carbs, but nobody ever said to me, well, why don't you try not eating carbs? I was, grew up in the 70s, and that was when the low fat came out. And my whole thing was how to eat less oil when I mixed my oil and vinegar for my salad. I mean, that was the big deal, was how could I get away with less, which, as we know now, is totally not going to help you. I was constantly in meltdown. So, years went on, and I was determined to get, 20, 30, 40 pounds off, whatever it was. And I started a running program, and I would put my kids in the front yard, and it was in Navy housing. It was totally safe. There were neighbors everywhere. They were like 5 and 7, 6 and 8. I don't remember. I put them in chairs in the front yard. Our block was a mile around within Navy housing, and I would peel an orange before I left. I would carry the orange with me so that when my blood sugar started to drop, I could eat the orange and keep running for my second lap around the 1 mile block, just to keep my blood sugar up, So I was never the kind of person who, I never once missed a bolus because I wanted to lose weight. I did know that if I had too much sugar in my bloodstream, that I wasn't going to absorb all the calories that I was eating. But I was concerned about my health, even way back then. I went back to school, wanted to become a dietitian, and I studied nutrition for almost a year. Except when I did it on myself, it didn't work. So I left school. I went to Cuyamaca College and Grossmont College in San Diego. And so I left that searching for an answer, just absolutely searching for an answer, you know, how to get better.
You consider leaving your husband?
Yeah, I went right after my diagnosis. I thought that it would be better for me to just go. I mean, he was in the military. He was good. Both of, I had my family and his family that could help with the kids, and I felt that it would be better if they didn't lose their mom at 50 years old. Because at the time, and I knew it, A1C to 11, 12, whatever it was at the time, you can't run at 300 all the time and expect to make it. It wasn't like I wasn't trying. But I decided that wasn't a good idea, and I hung in there. My husband's phenomenal, so supportive through the whole journey. I'm glad that I stuck, because now I'm going to be 59 years old, and my children are 37 and 39. I have 7 grandchildren, and that would be a horrible thing to have given up. But I wish that I had known then what I know now. I wish I had.
I understand. I'm glad you stuck with it.
I had severe. Yeah, me too, because I've got a beautiful family, and it was all worth it. I mean, my first thing, I didn't really bargain with God, but the first thing I thought of was, okay, well, if I get to 50, I'll be happy if I get to 50. Okay, well, I want to see both of my children grown and married and happy. Okay, then I got that. And I said, okay, well, maybe, and I'm still here and I'm still going. So yay for that.
All right. And you mentioned in the little story you gave me beforehand that you tried a lot of different things before finding Bernstein. So what else did you try?
Well, I am not a fan of meat, I must say. I really have never liked it. I used to smear sour cream on roast beef when my mom would cook it. My dad would say, "You can't put sour cream on roast beef." And I'm like, it's the only way I could choke it down. I just don't like it. So I know. But I was a vegan for 3 years. I spent 17 years allergic to chicken. I had many, many, many allergies, chicken and eggs that were not fully cooked. So I got out of all the turkey stuffing. I didn't have to stuff the bird. I didn't have to clean up the mess. I didn't have to do anything because I was allergic to all poultry. So after the vegan thing, I was like, I really love cheese, and I love some of the other things that I can't have, cream cheese, yogurt. So I decided vegetarian. After all those years were gone, I found out that I wasn't allergic to, it was just a freak accident that I touched some chicken to make a special dinner for my son. And I touched it and I was like, wow, my hands don't itch. This is really weird. And then I tried some egg and everything was good. So I was vegetarian for a couple of years because I knew that the answer was eat all the fruits and vegetables I wanted. If I could just eat all the fruit and vegetables and not eat meat, and don't touch the butter or the cream because it was too high in fat, and I was supposed to be eating low fat for my heart, then everything would be good. And it still wasn't good. So I had gone to school for nutrition, done everything that I was supposed to do there, trying to learn it for myself, dropped out of that because it wasn't working, did the vegan thing, did the vegetarian thing. And then I kind of, in the midst of these crazy carbohydrate binges, because it would take me months. If I ate some cake, it would take me months of, I described to you the getting up in the morning, eating, I don't know, it could be 50, 60 grams of carbs, but it wasn't a cake. And then only making it until 1 or 2 or 3 o'clock in the afternoon before I was crazy. I mean, I was crazy to go find carbs. And I just really thought that was just how it was going to be for all my life. That's just how it was going to be. And I have asthma, I have COPD, and of 10 cut, 7 out of 10 fingers, which is, I didn't know, a complication of diabetes. So I only have 3 fingers that haven't been cut. I've got carpal tunnel, got very high cholesterol, which I've been fighting the statin drugs for a lot of years, and now I'm glad that I did. But also, and a lot of people don't know this, but I'm going to go ahead and spill it because I think that in Dr. Bernstein's book, I found a little clip that I'm going to have to do some more research and maybe even get, his online questions that he allows you to ask once a month. I may have to actually get with him. But in his book, he said something about diabetes and high blood sugar and tumors. And so when in 2000, I was 40 years old, and I'd been having double vision and extreme headaches for a long time. So I went to my endocrinologist, who sent me to my ophthalmologist, and he said, "Has this been going on for more or less than 6 months? Because it could be a third nerve palsy, which is quite common with diabetics, but it goes away on its own." I said, "Nah, it's been longer than 6 months." And so he sent me for an MRI. And I came out of the tube screaming because I couldn't be in there. So they put me out, put me in there, found out that I had a brain tumor. That's what's causing the double vision. That's what's causing the headaches. That's what, anyway, they radiated in 2000. They radiated it at the time, it was an untouchable tumor. It's in the cavernous sinus, and you just don't go there. It's wrapped around the internal carotid artery. So skip forward, after living with high blood sugars and doing the best that I could and eating healthy, low fat, skip forward, and I find out that this tumor is growing again. Now I have access to the internet, and I start doing research, and I find out that something called a ketogenic diet may be able to help with tumors. Of course, it was malignant tumors, but even though this was thought to be, I mean, they didn't have a biopsy or anything, but they said it was most likely benign, just in a really bad spot where it couldn't grow. So I knew it was up to me. I mean, if you can't do surgery on it and there's no medication, then I had to figure out how to fix it. The radiation was good for about 16 years. It knocked it down for 16 years, and then it started to grow again. So this was about, I think it's about almost 5 years ago now. I put myself, and my entire family thought I was crazy. I put myself on as close to a ketogenic diet as I could get and as I could figure out. And a most amazing thing happened. My blood sugar came down. And I lost 40 pounds, which I had been struggling to get off my whole life. But my blood sugar was like a flat line. I've been on a sensor, a Dexcom sensor, for about 6 years. And I was amazed. I'm like, I was telling my husband, I can't believe this. After all the stuff I've tried, of course, I wasn't supposed to be eating high fat, and I didn't like meat. So I went back in to the doctor after about 2, maybe a little bit more than 2 years of doing the best I could. I'm not saying I stuck to it 100%. But I really followed as close as I could, maybe a little bit more protein. But I love avocados, and I love bacon, and I love eggs and all that kind of stuff now. So I was pretty happy. And the MRI showed that it didn't stop it from growing. It still continued to grow. I just lost some weight, and I had better blood sugar. So I had also started having seizures. Now, certainly not grand mal seizures. When you look at me, you wouldn't even know that it was happening. It's called a simple complex seizure. So it only involves half the brain, not the entire brain. Some people get kind of spacey. With me, I feel an impending doom. I feel kind of like, as a matter of fact, my neurologist treated it as panic attacks. Put me on Xanax for about 2 years. I was treating panic attacks, which they weren't panic attacks, they were seizures. And so on and off the ketogenic diet, having these seizures, surgery that I can have. And so July 10th of 2017, not quite 2 years ago, I went to Tampa, and they did a great job. They went in through my nose, broke out the back part of my sinus, and removed a portion of this tumor. It is still wrapped around the carotid artery. It's not touching the optic nerve, but I lost the sixth nerve, which controls the eye movement this way. And the third nerve, which controls it this way, is damaged. And the trigeminal nerve is damaged. So I don't have any feeling, any part of my face here. I can't feel my eye, my palate. So I had that surgery done, and it's been almost 2 years. And I was going back to my neurologist, and I had been kind of on another carb fling, went back to my neurologist, and I maxed out on one of these medications. And told my husband, I said, I'm just going to try this again. Right about the time that I fell into Dr. Bernstein's book, because I'm constantly researching on the internet. And I think I came across the Type 1 Grit site or something, one of them on Facebook. And I got the book, I ordered it immediately, started watching every video that I could of his. And it has been almost 2 months. Seizure activity is almost gone, almost none. And I am no longer on the maximum dose of medication. I backed off. So instead of being on 4 tablets a day, I'm only on 3, and I'm having almost no seizures. Lost 13 pounds. My blood sugars are almost flatline. So the difference, and I have not, the funny thing is, me, super sensitive carb addict, have not had one cracker, one grain of rice, have no desire for it. The farther you get from it, the less you want it.
Absolutely.
So
for me, it took a while. It took like a couple years for me to wean myself off those carb addictions, but at a certain point, just like you said, you just stop craving it. You just, I don't need it anymore. You crave the foods that are good for you. You don't crave the ones that aren't.
Right. And, I've always been a huge fruit and vegetable nut. And you ask this in your interviews a lot. And I made a notation of this because I want to tell you, you ask, did anybody ever tell you not to eat carbs? And the only person that ever even questioned me, I was in the ER. I would go to the ER before I went into DKA, because if I started getting nauseous, I would go in there and tell them I needed a big drink. I mean, I would bring the paramedics cookies at Christmas time because they've been to my house so many times to wake me back up. But I would go in, and the ER doctor looked at me. I guess I had told him what I'd eaten. And he said, does your doctor know that you eat that much fruit? And I went, yeah. And that was the end of that conversation. That's the only thing I ever remember. I know, because I love fruit and vegetables. Get up in the morning, almond milk, a handful of berries, another handful of berries, some almonds, half a banana. Wow, this is fantastic. Big, huge salad. It was, I don't know, I was into this a couple of years ago. I was well into it before I realized that a head of romaine lettuce had 9 grams of carb. 9? Okay, so then I can't have 3 tomatoes with my head of romaine. That was what I had done my whole life, just about. Huge salads, lots and lots of fruit. Now I feel guilty because I fed my kids lots and lots of fruit. Although for people that aren't diabetic, I don't think that fruits and vegetables are a bad thing in a greater amount. But certainly for me, I was only ever hospitalized for DKA twice, and I was pretty sick. But like I said, I would know it was coming on, and so I would go to the hospital when you can't sip any more water, and you can't, over and above the pump. I would inject insulin, and you're injecting 10 units at a time, and it's not coming down, you're just behind the 8 ball. And I would just go in and tell them, give me a big drink. They'd hook me up to an IV. In 5 or 6 hours, I'd be able to go home and without ever actually going into DKA. But the hardest thing for me, once I figured out not to eat so many carbs, was going low. I think my lowest, I think my husband said was like 18. I was 18, and he came home early one night, and I was already asleep, and he spoke to me, and I didn't respond, and he checked my blood sugar, and I woke up to, I don't know, 2 or 3 paramedics at the foot of my bed, and then the same thing happened because I was determined that I was going to get my blood sugar down. I was just determined. 2 or 3 days later, I was sitting in the chair, and I woke up, and I went, oh God, not again, because they were the same paramedics, So to try so hard when you take huge amounts of insulin doesn't work,
And that's the advice they give you, is just eat a bunch of fruit and vegetables, take a crap ton of insulin for it.
Eat healthy. Don't eat fat. Don't eat fat. You're going to get heart disease. And still, some of my family members are hanging on to that. You're diabetic. You can't have all that fat. You're going to have heart disease. And, if I'm going down, this is how I'm going. If I'm wrong, this is how I'm going. Because I'm done with the trial and error thing. This is the only thing in 34 years that I've ever done that brought any results. I can't wait to see my next A1C. I'm expecting in the 5s. I had a 6.2, and the doctor said, well, this is really good. And I was like, that's the lowest I've ever had in 34 years. 6.2 is the lowest I'd ever had. Now, after reading his book, I'm like, this is not good enough. You got to do better than that, So, but one of the things in his book, and I tell people about this, if you are driving in your lane, and I think I'm saying it the way he said it, if you're driving in your lane, it's like taking insulin. If you jerk the wheel hard to the right, you're going to wreck in the next lane. If you jerk the wheel hard to the left, you're gonna wreck in the other lane. But if you just move the steering wheel just a little bit, you're gonna be able to recover from it easily. It's like taking insulin. You eat a huge bowl of spaghetti, which happens to be one of my favorite things, with garlic bread. That requires a lot of insulin. Now, you take a lot of insulin, you have in your sight going very much wrong. You could go way low because you overestimated, or you could go very high because you underestimated. But if you're just taking little bits at a time, 10 spears of asparagus, you're taking a little bit of insulin. I'm not going to be 30 because I took 1.5 units of insulin. It's just a different, and I've not had many lows. It's been pretty much, when I say I've tried it all, I've tried it all. So this is the way it is. This is the way, because to me, this is about as close to a cure as I'm ever going to get. Really, because if I can get my blood sugar with a little bit more practice, if I can get my blood sugar down to what is a normal person, a regular person without diabetes, if I can get my blood sugar down in that area, that's like a cure. It's a cure with, a little sidecar of pain in the neck, because you got to test and you got to do all this other kind of stuff. But you can save yourself from all of the, the things that happen down the road. You don't get any, there are no do-overs. I'm almost 60 years old, and I now am stuck with what I have a little bit of retinopathy, but I just went to my ophthalmologist a couple of weeks ago, and there's been no progression in 2 years, none. And I know that's because I was following a ketogenic diet before the surgery, trying to make this thing go away, which had side effect. So
That's fantastic. As far as other complications go, aside from retinopathy, you mentioned stuff like COPD and stuff like that. How are you doing now as far as those other complications go?
um you know, that's pretty much the same. I think the asthma, I've been had a lot of allergies for all my life, all my life. And I've tried to stay away from things like oak. I've been through 3 sets of shots and injections. That's pretty much the same. That's pretty much the same. I have chronic ischemic small vessel disease, which it changes in the blood vessels in the brain, and this is probably due to diabetes. It could also be due to high blood pressure, but I've been on a blood pressure medication for 20 years, so I'm more inclined to think that this has something to do with uncontrolled diabetes for the amount of years that I've had it. My father died from a hemorrhagic stroke, which could have come from a similar, so it could also be a little bit of hereditary factor in there. I'm expecting that will get better. I'm hoping that will get better. The seizures, the difference in the seizures, I can't tell you. When you're on the maximum amount of medication, it's still happening 15 times a day. And then you eat differently. And 3 days later, you say, oh my gosh, I haven't had a seizure in 3 days. I don't remember one. So they're so mild. So that really is the biggest life changer for me, because I didn't want to go to sleep at night. I would lay down, cuddle up to my husband, and know the second I dozed off that it was going to slam me and I was going to be awake and in a panic. It doesn't happen anymore. Another complication that I don't know that people, well, the trigger fingers, of course, and the carpal tunnel, but I think another thing that Dr. Bernstein mentioned in his book was the cracked heels. I have been dealing with dry, thick, cracked heels for 25 years or 30 years, not in the beginning. And I've noticed in the last couple months, cracked it to the point where my husband would put Neosporin on the crack and a Band-Aid, and I would walk around on the fronts of my feet because I couldn't put my heels down on the floor. That bad for days. And then the Neosporin would help and they'd go away for a little bit. And now, totally different. Totally different. I won't say it's a baby's butt, but I don't have cracks anymore. So that's a huge change for me. And they're kind of life-changing things. When you can't walk, you think, okay, you got cracks in your heels, so what? My family likes to walk. We get together all the time, and my aunt has been running and walking for 50 years. And when she comes to visit, she would say, okay, everybody, okay, family, let's go for a walk. And I'm like, we need to hurry up, because if I eat breakfast and I take insulin, then I can't walk because I'm going to go low. And I know I'm going to go low. So I would always be the one carrying a granola bar just in case. And my daughter was like, oh my gosh, look at you. You can't even go for a walk without taking a candy bar. So it was funny because you have to have that stuff on you all the time. And I don't even carry it now. I don't carry glucose tablets. I have them on my nightstand, but I'm paying attention during the day, and I don't go low anymore, because if I see a trend going low, I can back off on I'll put a temporary basal rate, and I don't ever see that number.
That's fantastic.
So,
yeah. When did you start the Bernstein approach anyway?
His program just a few months ago. We were in Key West, Florida, visiting. My niece had a baby shower, so we were down there. And the day that we left, I decided that's it. I'm not eating any more carbs. I'm not going to partake in this cake fest anymore. You can get away with it. I can't. No More Carbs from, and I started doing the research, and that's when I found his videos and the Facebook pages, and I immediately ordered his book. And when I found out that, one of my issues with ketogenic diet is that even though I love almonds and avocados and olive oil and stuff like that, I'm hungry. And so the more protein in his recommendation, it was huge for me, because I like a ribeye. I'll take a little portion of a fatty ribeye, but that's even new for me, But I think it's probably been close to 2 months. I'm not hungry. Like I said, I've lost 13 pounds or more. I feel light on my feet. And I think it's the inflammation. I was diagnosed with trying to think of what it is, where the constant pain in your whole body. It was through a rheumatologist a couple of years ago, and come to find out that wasn't it at all. I didn't need any medication. I didn't need sleeping pills. What I needed was to get the inflammation out of my body, and that meant carbs. And my endocrinologist has been great with this. As a matter of fact, I wanted to tell you about this because I think that they might be starting to think a little different. And it's people like us who are trying to get the word out, because I'm telling everybody that I know. Go back and look at the research. It's not fat, it's sugar. Look at what happened to our grocery store shelves. I can recall we had cereal. When I was 7 or 8 or 9 years old, there was a glass jar of Lucky Charms on the counter, and I opened it up, dumped it all over the counter, picked out all the marshmallows, put it all back, and ate the marshmallows. So this has been a long time. Yeah, seriously. So, for me, it goes way back. But when we started including more of those things into our diet, when we wanted a bigger house, hate to say it, we wanted a bigger house. And so everybody works longer hours, which means you need to have a faster food prep. And I've been fighting that my whole life. My husband and I have been married almost 40 years, and I've been fighting that, trying to keep cooking in our relationship, whether it's I cook, you wash dishes, or, chop this, chop that, because I think we're missing that. But I do think that the endocrinologists, I think they're realizing that. Mine kind of looked at me a little funny, 5 years ago, when I said, I need to do something with this tumor because there's really no help out there, and I'm going to try this. Well, she really couldn't say, I don't think that's a good idea. It was my only idea. And so she agreed. My cholesterol went up, and finally she did to see the size of the particles, and the small particles in the LDL, which are supposed to be the bad portion of the LDL cholesterol, was like 225. But the large particles of cholesterol, which are maybe now even suspected to be beneficial, was 6,770. So the ratio to my large particles and my small particles, she never called me back and said, okay, I want you to take this statin. And I think we're going to put a lid on that. I don't think she'll approach that again. And I'm going to bring her, I have an appointment next week. I'm going to bring her Dr. Bernstein's book, because even though she is a doctor and she's been through all the medical training, I think that she is one of the doctors that would be willing to say, okay, maybe not everybody can follow this, but maybe some people can. And if those some people tell other people, those other people tell somebody else, especially for the type 1s. So, I was 25. I was lucky, and my C-peptide is a 0.1. And I've been saying, my doctor's been telling me all these years, you're in denial. And I'm like, no, I'm going to fix this. No, you're not. You're not going to fix this. But I was so fortunate to be 25. People who get it when they're 2, 3, 10, right in the middle of the pizza years. I knew a young boy And he's been diabetic for more than 10 years, 12 years. And we were camping. And, I was thinking, if you're going to eat a hot dog, but leave the bun alone, please. Don't take. And he was figuring his insulin and he was taking it and that off with the friends, I mean, they eat hot dogs with buns. And if diabetes hurt when it was still new, I don't think that the outcomes would be the same. I don't think that the information is out there and available to diabetics like it should be. But if you get online and you research it, the information is available now. It's out there. People like you are out there going, hey, listen, we got to pay more attention to this. And the drug companies are running hog wild. Just such a shame because a lot of people just don't know and it's so easy. Oh, I could never give up pizza. I've heard that. I could never give up pizza. I could never give up French fries. Yeah, you can. You can. You really can.
It's all a matter of priorities the way I see it. Because, I mean, what would you rather have? More pizza or a healthy life? It's easier case to make for us, especially because, we feel it when we're making a bad choice on what we eat more than anyone else does. And so that's why I'm trying to focus so much on type 1s, is because it's just such an obvious benefit. And I think once you really try it, once you get past the denial, once you get past the, oh, I can't do this, I'll never be able to last, once you get past it and actually do it, you realize, oh, this actually works. It's actually a lot better than I thought it'd be. It's actually a lot easier. And hopefully more people will do that.
It's just a matter. Yeah, it's just a matter, I think, of turning off your I've done it like this my whole life thinking. I have a very, very close friend of mine from high school. And I'm not going to say her name because she's going to kill me, but she's going to watch this because I've been really coaxing her to get on the keto diet. She, I'm sure she has depression. And she's already has an amputation below her knee. And she went through 2 pregnancies with type 1 diabetes. And there are still people in her family that think she has diabetes and it's her fault. So the amount of knowledge out there is about this big. It's just the older people, like my mother knows that this is not my fault. And she's type 2 diabetic and she's even making some of the keto desserts, instead of reaching for the sugary stuff. But my very, very good friend from high school she sent me a message and she said, I hate the way I feel. I hate this. Okay, tell me how to do it. I was like, yes, because we've been talking about this for years, about don't eat the wrong foods and, get on an insulin pump, because I thought I had all the answers all those years. Get on an insulin pump and eat low fat, and here I'm talking and talking and talking, and I'm saying everything wrong. So it's hard now to go to people and go, okay, guess what? I was wrong. Eat all the fat you want, have bacon, just make sure. Because I am very open and I love to research. I love to study, and I don't want to say I like to tell people they're wrong, but if I'm living it and I know that it's right, I'm certain that everybody else should follow this. It gets me in trouble sometimes, my family says, get off your soapbox.
I'd say it's better to be outspoken than to hide it. And honestly, honestly, I encourage people to be more open about it, especially if you know any other diabetics. You never know who might need the help. And that doesn't mean you push it on everyone. It doesn't mean you try to force your ideal diet on everyone around you. But don't be afraid to talk about it. Don't be afraid to share the experience you've had on it, because, who knows, you might just convince someone and change that person's life forever.
Right. Yeah. And there are a lot of people in my immediate family. I think there are 5 people at our family get-together dinner table. I think that there are 5 people that are diabetic. And I come over with my own plate. My mom, my poor mom, she puts up with so much on me. She said, well, aren't you going to eat what the rest of us are eating? What are you eating? Well, we're having lasagna and salad and garlic bread. Nope. No. And I bring my own plate. And now I got my husband on board. And we'll see what happens with the cardiologist. He's got a little calcification in one of his coronary arteries. And I've got him on Dr. Bernstein's plan. I mean, he's right there with me every meal. You can have 10 spears of asparagus, and you can have 2/3 of that steak. And he's losing weight, and his cravings are already gone. And this is the French fry king. But the fact that the cravings are gone because people think that they can't do without it. I mean, I went on a ketogenic diet. Dr. Bernstein's plan is better for me because it's higher in protein, and I feel like if we go out to eat, I can have cheeseburger on a little bit of lettuce with a tiny slice of tomato, a tiny slice of onion, and I'm not sitting there staring at the wall. But on a true ketogenic diet, where the protein is limited to what is it, 15%? A therapeutic ketogenic diet, I believe, is 5% carbs, 15% protein, and 80% fat. That's very difficult to follow. I even asked my neurologist once, I said, does this work for people with seizures? And he said, it works for children with seizures. Adults can't do it. And so that was part of the reason that I just went into it head first. Look, if this works for kids, it can work for me. So, but my husband follows exactly what I do. And diabetic or not, I mean, his A1C was 5.6. And his doctor said, well, we'll talk about medication if you get to 5.7. Okay, 5.6 is too high. Type 2s are take the medication and eat what you want until finally you're put on insulin, which according to the book just means that you're going downhill faster on roller skates,
I find it so bizarre that they have this big range of where you can be at before you're considered to have a problem. Especially since, I mean, A1C is not the first thing to go up when you start getting diabetes. There's a lot of other things happening decades before then that are having an impact before
Right.
you even get to that point. It's crazy. It's crazy. And I'm glad to see your husband's on it now. I'm glad to see he's doing well. We're already approaching almost an hour on this, so I'll go ahead and ask my final question for you, if that's okay. What
Okay.
is the
Sure.
number one thing you love to tell any diabetics watching this video?
Any diabetic that's listening, probably two things I would say. One is you don't get to go back. You don't get to go back. When you lose a leg, when your vision starts to go, when you get put on dialysis because your kidneys aren't working properly, that is not the time to wish that you had paid attention. The other thing is that eating the way that we're told to eat does not solve the problem. And I would say, test it on yourself. Test it on yourself. Eat carbohydrates and see what happens. Eat meat and fat and small amount of vegetables and see what happens. And see which one is easier to follow and which one gets you where you want to be. Because when you're my age and you had it 34 years, you don't get to go back to the beginning. You just don't get to. I'm very fortunate. I don't have any kidney disease. I have some other issues, but a lot I may not even know of, and I'm turning them around. Really knows what it needs, and pizza is not a requirement.
Exactly. Carbs are not essential. There's no such thing as an essential carbohydrate, and I hope we can get the word on that out more, because
I hope so too.
All right. Well, we'll leave it at that. Thank you so much for your time today, Beverly. I loved hearing your story. and I'm so glad to see you're doing so much better now. If you said are you getting your A1C checked in a week? You said.
No, I won't have it checked for my next appointment is May
Okay.
31st. I'll have it checked about a week before. I'll put it on your page. But I'm following the new app, which I didn't know existed. The sweet sugar. Anyway, I'm following it where it has the predicted A1C according to what your blood sugars are running right now, and it's telling me I'm about 5.8.
Fantastic. It's a lot better than before.
Feeling pretty good.
It's a work in progress.
It's a lot better than before. Yeah, and as I go into it, the app can only tell me since I put it on my phone. That's all the app can tell me. But I feel about 1,000,000% better. I feel light on my feet and I get up easier and life is just better. So it's worth a shot. Hey, try it for a month and see if you feel better.
Fantastic. Well, thank you so much for your time, Beverly. You have a wonderful night.
Okay.
And
Thank
this
you.
is how Beverly tamed her type 1.